Greeting to all. Today, just I'm going to make an presentation on the topic called push button technique. It is one of the techniques suggested by Alfred Adler. Adler is a renowned psychologist, and he departed from Sigmund Freud. He started his own school of thought that is called individual psychology. In that individual psychology, he discussed a lot about the importance of birth order, lifestyle, and inferiority complex, and how that helps the person to make up of their personality. And in his contribution, not only limited to that personality development, and he also contributed a lot for therapeutic component also. In adlerian therapy, there is a master degree program is available as of now, in which a person who is taking up the master degree program, they can get a 2 years program in which they will get almost all the sub technique which is used in adlerian therapy in detailed manner, and more case studies will be discussed in the presentation. So there are many techniques are there, and one of the techniques is push button technique. Okay, so I'm going to just talk about that push button technique with you. And one more contribution which is very important, I feel that adlerian contribution is that when a client come for therapy, when you want to understand that the client, understand the problem of the client, understand the intensity of the problem they are having, and what is the root cause of the particular problem. For that, we need to ask a question, the interview. And he is the person who systematically prepared 18 questions. When we ask that, we can able to get all these details. And as you all know, that therapy is nothing but a treatment for the illness. Okay, psychotherapy is a treatment for the mental illness. So there are broader therapies are there, like behavior therapy, adlerian therapy, gestalt therapy. There are n number of therapies are there. Each therapy has a different techniques. It is called a more specific way to deal with the problem of the person. And these things will be more effective when we use appropriately. In my understanding, behavior therapy has more techniques than any other therapy. Based on my reference research, behavior therapy has more techniques than any other. But in adlerian therapy, he suggested there are 15 techniques. Among the 15 techniques, one of the technique is push button technique. So among the 15, it is one of the technique. Just I will let you know what I mean by push button technique, and what is the procedure we have to follow to understand the concept. Everything we will discuss in my presentation. In another 20 to 30 minutes, we'll discuss it. Actually, this push button technique was developed by Harold Mossack. He is the person who developed based on adlerian assumptions. What adlerian assumption? That every feeling there is a cognizant. Under every feeling, for example, it may be happiness, sadness, whatever it may be. If we have any feeling, any emotion, that has a cognizant. And these push button technique not only take that assumption of Adler and also take that inputs from that Albert Ellis rational emotive behavior therapy also. This push button technique originally developed for working with a client who are struggling a lot with the depression. Any person who are struggling a lot because of depression, they can use these things. And in this technique, this push button technique, clients are responsible for both good and bad feeling, what they are holding, what they are having, what they are experiencing. They can create their feelings by thoughts, by choosing to have it. For example, if they want to have positive feelings, they can have it. If they want to have the good feeling, they can have it. At the same time, if they want to switch over to the negative, yes, they can do that. Generally, we human beings are moving towards that positive feeling. good feeling. And that can be achieved in this technique. As you all know that at CBT, the thought creates feeling. When we want to change the thought, we can able to change the feeling and behavior. Vice versa, when you want to change the behavior, that will change the thought and feeling. When you want to change the thought, we have to change the other two components. And that is a lot of discussions, a lot of inputs are available. Thought is nothing but what we think, that determines what we believe. What we believe, that determines how we feel. The way we feel influences how we are going to act. So each one has an influence on other things. When you want to change one way, you can change other things. For example, one of the list of negative emotions: worry, stress, fear, impatience, and sad, anxiety. List of negative emotions: anger, sadness or grief, loneliness, shock, and jealous and envy. These were some of the negative emotions. And the people who are experiencing this negative emotion, they want to change it to the positive one. They said that we are struggling a lot, I want to move to that other side. Okay. And negative thoughts create negative feelings. You have to accept that. Likewise, positive thoughts create positive feeling. What is push button technique? It is one of the therapeutic techniques. It helps the client by interrupt that depression and help the client aware about that, the role in maintaining that, even it create unpleasant feelings and to overcome that unpleasant feeling. Okay. The client use the push button technique to stop that unwanted negative, the thought that creates, the feeling that creates undesirable feelings to the person. If they want to change it, they can use it, these things. And they can replace with that to the positive ones. So what are the directions we have to use in push button technique? I will let you know that following techniques we can use that following directions. First one, step one, ask the client, close your eyes and recall that pleasant memory. Maybe once in your lifetime, we may have a pleasant memory, the time when the person felt happy, when the person loved by somebody else, and the person was successful in any kind of activity they taken up. And these situations, we have to ask the client to close their eyes and we have to ask them to recall that pleasant memory. Okay. And step two, once after done that, we have to ask the person to focus on as much as specific details in that experiences, in that feeling what they had, as much as detail as possible. And insist the client to focus on the positive feeling generated by the memory which were already stored. Okay. We have to ask them to focus on that feeling. And the third step is ask the client to stay with those positive feelings and memory as long as possible. As long as possible. After the client have relieved from the disturbed memory and experience a positive feeling, ask them to lift their fingers by indicating that they finished. Because they are close the eyes and they will do the exercise. When they completed a particular task, you can ask them to just move the finger, index finger. When they do so, you can understand, okay, they have done that. Then they can move on to the next step. Clear that unpleasant memory from the mind. How we can do that? For example, if there's a dust in our hand, we can wash them. Like in step 6. Now ask the client, close your eyes and recall an unpleasant memory which you had for longer recently that disturbs a lot of time, and it also intrude in your daily activities. Time when you felt sad, they unloved and unsuccessful, these things they can remember. Okay. Once done that, so as in the stage 1, focus as much as detail in that possible as strongly. Focus on that unpleasant feeling created the memory they had. Once they have done so, and again they have to do that, they have to stay with that feeling. Again, they have to lift their index finger, which means they finish that recollecting that memory, which is accompanying to the feeling also, the negative feeling also. And first one, they started with the positive feeling. Second, now started with the negative feeling. You come to know that. And the next step is clear that memory from your mind. For example, the second one you want to clear. You don't want to have that negative feelings. Now you have to instruct the client that they recall that first positive memory, or if you prefer, retrieve another pleasant memory. Already they given that pleasant memory. Now, if you don't want to keep that one, you can go to that another one. It may be on your experience, or you can create your own pleasant memory. Something you felt that now, if I want to do that, I will be happy. Now, something create that one. Okay, and again here, recall the memory in specific detail and focus on the positive feelings. Like the first time what we had, as much as detail you have to focus on that with the positive feeling. And the next step, when they have done that, so they feel that relieved from the pleasant memory, they feel more positive feeling. Once if they done so, they have to raise the fingers and they have to open the eyes. So when you look at that, it started from the positive feeling, indications, negative feeling, indications, and again positive feeling. Again, when you do so, here you can see two positive feeling and one negative feeling, and the person feels more comfortable. That is called push button technique. A push button technique, it is originally designed to show that the client, how they can create whatever feeling they want by thinking about them. If I want one positive feeling, we can have the positive feeling by thinking about that. The push button technique asks the client to remember a pleasant incident they had an experience. They have experienced. In this technique, they will aware about the feelings connected to that, and then they can switch on to that unpleasant images and those feelings. Here the client learned that they have power to change their feelings. Here they learn. It's not inborn. It is a learned one. So when you do so in push button technique, as I said, these were the references I referred for preparing this content. I will summarize that in push button technique is one of the adlerian technique. When the person having that more frequently some negative feelings, negative emotions, negative thought that surfacing and it disturbing his daily activities, we can use this technique. Very simple. The first step, ask them to close the eyes and ask the client to focus on that one of the positive feeling or thought which was stored in the memory, and they have to focus on that, and every detail they have to give an importance. Once they have done so, and you can see that the changes. Once they done so, you have to ask them to raise the index finger. If they done so, the client, the therapist, we can understand that the client completed the task. Because we insisted them, they have to focus on each and every component. In detail, they have to focus on that. Once after that, we can ask the client to focus on that negative feeling again. Negative images, which is disturbing a lot. Then they have done so, index finger, and finally we have to go to a positive feeling of which one you had in the first one, or else you can create your own or which one you had in your life. Now, once after done that, again index finger, open your eyes, and you can see the changes. And the Mossack, Harald Mossack, when he was developing this technique, adlerian therapy, it is very, very, very popular, and he himself had a depression, and he wanted to come out from the depression to use that technique. So, you all aware about that. These techniques will help us to come out from the depression, and any person, any client who come for your counseling setting for overcoming the depression, you can suggest that before advising, before taking this technique to the client, you can try yourself. Try yourself. Definitely you may have some unpleasant memory. You want to get rid of it and have focus on the positive side. I do so. And if you felt that these are more effective, then you can suggest to your client also. With that, I can stop here. Thank you so much for registering our initiative. Thank you. Thank you.